You said something, and my mind went to a conversation women have, and sometimes they get upset with OBGYNs for. Because once you deliver, sometimes if you have a tear, there are doctors who insist on giving you what they call the husband stitch. But what you're saying is that's not necessary. Don't put a woman through that. Come for the MonaLisa. Hey, so you got your glass of water, cup of tea, glass of wine. I am at Vivace Dermatology and Wellness Clinic on Riverside Drive. I need you to know where I am. On the first floor, yes. And I'm with Dr. Natasha. Everybody calls her Dr. Natasha. And I came here because I just don't want to have the necessary conversation for women over 40 and women who are experiencing the stuff that we talked about, and especially that pelvic floor laxity. You see, I'm a quick learner.
A quick learner.
Quick
well
learner.
Done.
But because they said we have a solution, and the only one, by the way, this is what they said, in East Central Africa, north of the Limpopo, south of the Sahara, there's nothing like this.
We're the only one.
You're the only ones. So tell me about the MonaLisa.
All right, the MonaLisa is the solution for women, okay? It's a non-surgical intervention that has been designed to fix the discomfort that your viewers are talking.
Just hold on, she said non-surgical. We all leaned in. Yes.
Yes, come closer. How does it work? It's a machine that works by delivering what we call carbon dioxide energy, which works to deliver gentle energy within the vaginal mucosa, which now works to fix that lubrication that we're talking about, helps to fix the laxity and the support structures of the vagina. You're enhancing collagen production. You're working on the musculature, which works to tighten it a little bit. So it's literally the solution that you've been looking for all the problems that we have discussed.
You said something, and my mind went to a conversation women have, and sometimes they get upset with OBGYNs for. Because once you deliver, sometimes if you have a tear, there are doctors who insist on giving you what they call the husband stitch. But what you're saying is that's not necessary. Don't put a woman through that. Come for the MonaLisa.
Yeah, although I will have to say its main indication is not tightening.
It is what?
No, it is, okay, in medical terms, we like to say it's FDA-approved for genitourinary symptoms of menopause. This is painful intercourse.
Yes.
This is persistent itching. Some women get persistent itching, yes, due to the dryness. Yeah. Persistent infections also because the flora changes due to lack of lubrication.
Yes.
Yes, and all these things. So that's the main indication. But because we're stimulating the wall,
collagen,
yes, and getting production, and we're enhancing what we call angiogenesis, which is production of new blood vessels, we then get a thicker wall, and you can then get tightening as a result.
As a result.
Yes, but remember the main thing we're treating is the discomfort that you're feeling either in during intercourse.
Yes.
The itching for some women, persistent infections.
The dryness.
The dryness.
Yes.
The dryness. That's the main thing. That's what we're treating.
And
the incontinence.
The incontinence. Okay. I was going to tell you, we started this conversation
with the incontinence. Because
we leak.
Yeah.
Yes, because we leak.
So for the incontinence, we pair the MonaLisa with what we call a pelvic floor muscle machine, which works now to, after we've done the MonaLisa, stimulated the collagen, now we work specifically on the pelvic floor muscle so that there's a synergistic effect. Okay. Especially for the women whose main concern is the leaking. So you can get, that's why it's tailored to you. It's tailored
so
to the patient.
When we come to see you for consultation, you say, what's the issue?
And we discuss and we go through it.
Okay.
And the MonaLisa will definitely be 70%, but for those who need the adjunct, especially if your main symptom is incontinence, we pair it with the pelvic floor machine, which works now specifically on the pelvic floor muscles to tighten and to enhance the structures around the bladder and the urethra.
Okay, so we all leaned in when you said non-surgical.
Non-surgical.
So how long does a session take?
A session takes, so you'll come in, we'll do a consult. Yes. Depending on how chatty we are, that can be 20, 30 minutes, but that's just a consult.
I like that, how chatty we are.
The procedure itself will be 15, 20 minutes. no pain, no downtime. You can come in during your work lunch break, get it done, go out, and nothing has happened.
Wow.
In and out, okay? You need 3 sessions, so spaced about 7 weeks apart.
All
and
right.
after that, then we maintain once yearly. That's it.
Oh my goodness. Okay, did you hear what she said? You said you will need 3 sessions, spaced 7 weeks apart. And after that, maintenance is once yearly.
Once yearly. We get women who have really enjoyed or rather benefited. So they come and ask if they can do it more than once a year because they're just like, I don't want to go back.
Oh,
Can
I found the good stuff. Yes.
Can I just do it? Maybe twice a year, every 6 months they come and, you know, depending on how things are going, then we analyze. But really 3 sessions and then a once yearly maintenance after that.
Wow.
Yes.
Can I ask you something?
Yeah.
As an aesthetic doctor,
Yeah.
One day we must have a conversation about why you chose medical aesthetics.
We can
and
have
not
a
other stuff.
conversation. Yeah.
It's when you heard about the MonaLisa, what did you think?
Weirdly enough, okay, when I was in the clinic and we decided to get the MonaLisa, I had my mom who was going through menopause. Okay. So advantageously enough, I'm close to my mom, so we can chat. And when this came, I was like, this is a conversation that no one has had.
Yes.
You know? I didn't hear it in med school. I didn't come across it. There was no solution.
What are
they
you
didn't
teaching?
Tell us they didn't tell us there were interventions for, you know, all these symptoms. I was like, this is perfect, you know? And women, there'll be a sister, a mom, and she's like, there are so many of us, no one knows what to do. You know, it's clearly something that needs to be talked about. So I was like, this is it. More women need to know that there is a solution. You don't have to suffer in silence.
There's an art cafe in this building on the ground floor. I'm going with her because she said something that just disturbed me a bit. It's not talked about.
It's not talked about.
In the unit in medicine where they talk about us.
Yeah.
Why is that not discussed? I'm going to have coffee with her. I'll be back. But meanwhile, you know where to go. You're already taking the number on the screen, so just come. Get a consult, depending on how chatty you are. She said 2030. And remember, it says 3 sessions, 7 weeks apart, and once a year maintenance.
Yes.
Oh, you love me. Thank you, Dr. Natasha.
Thank you, Caroline.